Hi, Eileen Veilleux the Fam here. Welcome to another installment in our mini mental health series. And in this installment, we will be covering what is histrionic personality disorder. But before we begin, let me just remind you to please watch the full video because throughout the video there will be 3 keywords. When I get to the keyword, I will say keyword, then what that keyword is. At the end of the video, in the comment section, along with a genuine comment about the video, put in what the 3 keywords are to be eligible for my free merch giveaway when I reach 2,000 subscribers. So what is histrionic personality disorder? Well, histrionic personality disorder is one of a group of conditions called cluster B, or keyword dramatic personality disorders. People with these disorders have intense, unstable emotions and distorted self-images. For people with histrionic personality disorder, their self-esteem depends on the approval of others and does not arise from a true feeling of self-worth. They have an overwhelming desire to be noticed and often behave dramatically or inappropriately to get attention. The word histrionic means dramatic or theatrical. This disorder is more common in women than in men, and usually is evident by adolescence or early childhood. Excuse me. So what are the symptoms of this histrionic personality disorder? Well, in many cases, people with histrionic personality disorder have good social skills. However, they tend to use these skills to, keyword, manipulate others so that they can be the center of attention. A person with this disorder might also be uncomfortable unless he or she is the center of attention, dress provocatively, or exhibit inappropriately seductive or flirtatious behavior, shift emotions rapidly, act very dramatically as though performing before an audience with exaggerated emotions and expressions, yet appears to lack sincerity. Excuse me. Be overly concerned with physical appearance, constantly seek reassurance or approval, be gullible and easily influenced by others, be excessively sensitive to criticism or disapproval. They will have a low tolerance for frustration and easily bored by routine, often beginning projects without finishing them or skipping from one event to another. Not think before acting and make rash decisions. Be self-centered and rarely show concern for others. Have difficulty maintaining relationships. Often seeming fake or shallow in their dealings with others. Threaten or attempt suicide to get attention. So what causes this histrionic personality disorder? Well, the exact cause of histrionic personality disorder is not known yet, but many mental health professionals believe that both learned and inherited factors play a role in its development. For an example, the tendency for histrionic personality disorder to run in families suggests that a genetic susceptibility for the disorder might be inherited. However, the child of a parent with this disorder might simply be repeating learned behavior. You know, we learn from our parents. The way we are in life, we pick up things from our parents, good habits and bad habits. So that's what they're saying is it's hard to say because if our parent has one of this, we can, we tend to learn. Just like child abuse. It's a chain that sometimes needs to be broken. Sometimes a child of somebody that was abused when they were a child, it repeats itself, just like history. But a lot of these things repeat itself. Okay? Other environmental factors that might be involved include a lack of criticism or punishment as a child. Positive reinforcement that is given only when a child completes certain approved behavior and unpredictable attention given to a child by his or her parents, all leading to confusion about what type of behavior earn parental approval. Personality disorders also usually develop in relation to individual temperament and psychological styles in ways people learn to cope with stress while growing up. So is this histrionic personality disorder diagnosed then? Well, if signs of this personality disorder are present, the doctor will begin to do an evaluation by performing a complete medical and psychiatric history. If physical symptoms are present, a physical exam and laboratory test, such as neuroimaging studies or blood tests, may also be recommended to assure that a physical illness is not causing any symptoms that may be present. And if the doctor finds no physical reason for the symptoms, he or she might refer the person to a psychiatrist or a psychologist, healthcare professionals who are specially trained to diagnose and treat different mental illnesses. Psychiatrists and psychologists use specially designed interview and assessment tools to evaluate a person for a personality disorder. So, how is this disorder treated? Well, histrionic personality disorder in general is treated in general in general, people with this personality disorder do not believe they need therapy to begin with. They also tend to exaggerate their feelings and to dislike routine, which makes following a treatment plan difficult. However, they might seek help if depression, possibly associated with the loss or a failed relationship or another problem caused by their action, causes them distress. Psychotherapy, which is a type of counseling, is generally the treatment of choice for histrionic personality disorder. The goal of treatment is to help the individual uncover the motivations and fears associated with his or her thoughts and behavior, and to help the person learn to relate to others in a more positive way. Medication might also sometimes be used for treatment for other conditions that might be present with disorder, such as anxiety and depression. Are there any complications with this disorder? Well, histrionic personality disorder can affect a person's social, professional, or romantic relationships and how they react to losses or failures. People with this disorder are also at a higher risk than the general population to suffer from keyword depression. So what is the outlook for somebody with histrionic personality disorder? Well, many people with this disorder are able to function well socially and at work. Those with severe cases, however, might experience significant problems in their daily life. Is there any way that this disorder can be prevented? Well, although prevention of histrionic personality disorder might not be possible, treatment can allow a person who is prone to this disorder to learn more productive ways of dealing with different situations. Excuse me, my throat is dry. And so that's histrionic personality disorder. And I'm sure we all know a few of them. We call them drama queens or drama kings. You know, the person that is self-centered and has to be the center of attention, whether it be good or bad. It's like, hey, look at me. You better pay attention to me. That type of person. And we all know a few of them. So, instead of putting someone down, think, is it possible that this so-called drama queen has this histrionic personality disorder? Okay, let's say they do. What then? Well, at that point, you know they have a mental illness. Now, they're not going to admit to it because of the type of mental illness it is. Not everybody will admit that they have any type of mental illness unless it disrupts their life. So the best thing is just take what they say with a grain of salt. You don't have to be mean. You don't have to plaster everything all over the internet. And be careful what you say, because when you put other people, when you plaster something on the internet, you could hurt other people instead of just that person. And that's not worth it. That's why it's so important to see with your heart and not your eyes. This world will be a much better place if we all learn to see with our hearts. These eyes see a shell. That's it. The heart sees what matters because that's invisible to the eyes, and that's what's inside of a person. And that's what we need to see. So always see with your heart and not your eyes. And until I see you next time, remember, I love you all. You all mean the world to me because each and every one of us was put here on earth for a reason. And we're not here to judge, but to show love and compassion and kindness to one another. So until we see each other again, have a great day. Bye.